Okay, hello everyone and welcome to today's session. Thank you for joining us for today's webinar. Today we all have joined here for session on community health nursing, assessment, education and program planning. For attendee, if you have any question during the session, please type them into the question box in your control panel. Now, I welcome Professor Bethany, Professor in Western University of Health Sciences and her team as a speaker for today's session. Now, without further add-on, I would like to pass on the session to Professor Bethany and her team. Ma'am, please.
Thank you so much. And actually, first, I would like to have my colleague introduce me formally. Shara Ali, please.
Hi there. My name's Shara, and I'm presenting from Toronto. So it's 10:30, almost 10:40 p.m. here. But it is certainly my pleasure to present my colleague Bethany Thrasher, who is a registered nurse licensed since 2007 and currently employed as a nurse educator. And her career has brought her experience in a variety of specialty areas with highlights in community health, women's health, mental health, and forensic nursing. And Bethany has a passion for global health issues and led numerous short-term study abroad programs for the International Education Global Public Health Program for West Coast University. Bethany has graduated with her BS in Business Management from the University of Phoenix and went on later to a career in nursing with her BSN and Master of Nursing in Education from Chamberlain College of Nursing. At the moment, Bethany is pursuing a doctorate of nursing practice degree with Western University of Health Sciences with a focus on mental health as a vulnerable population. Bethany also holds California certification in public health nursing and has completed training as an international forensic nurse examiner. And she's an active member of the International Honor Society of Nursing Sigma Theta Tau International, and she also holds a board position with the Chi Beta chapter. And presently, Bethany serves as the co-chair for community engagement with the Doctor of Nursing Practice Association at Western University of Health Sciences. So welcome, Bethany.
Thank you, Shara. I really appreciate your introduction, and I'm really excited to be here with everyone. I am a student at Western University of Health Sciences, and I'm proud to be that. And I had recently made a journey to Chitkara and to ChitkaraU University in fall as a fellow with the College of Graduate Nursing with Western. So I'm really happy to be here today, and I was curious if in our audience members, we have one polling question, if I can figure out how to get it to launch here. One question for you, if you are in the audience and you were actually part of the Global Week in at Chitkara in fall of 2019. Oh, I'm not seeing that question. So, yeah. That's okay. I just was trying to get a better understanding of the audience, and I appreciate some of the students already typing into the chat. As you know, that's where you can ask us questions here this morning. So again, thank you, and I really appreciate the lovely introduction. And what I'd like to do is just take you slowly through my own experience with community health education, and we'll be talking about the role of the nurse. And if you would, join me for the next slide. Now, this does not look like community health nursing, does it? I would like to just ask you just to take one moment with me and peer into this beautiful green lush jungle, and imagine yourself there walking along, hearing the birds, listening to the jungle. I'm actually not sure on the location of this particular photo, but it's very lovely, deep green, very relaxing and refreshing photo. I would invite you, if you're comfortable, to close your eyes. If not, just to join me for 3 slow, deep breaths, just taking in the morning, breathing in all of your positive, calming thoughts, blowing out all of the negativity, the hurry, the worry that you might have had on your morning arriving at the session today. just relaxing your mind, slowing down just for a moment, trying to become present right now for this time that we have together. I just wanted to hold a little bit of space. I know that we're all hurried and worried about many things in our lives, and I just wanted to hold this small moment of space for you just to take a moment and be present today. So thank you so much for that time. Now, one more breath in and out, and we will move to the next slide. Okay. Here we go. So our agenda today, we're going to talk a little bit about public health and the mission of public health, and we'll go through the steps of the public health approach. I'll share just a couple of touch points on levels of prevention in terms of community health and the role of the community health nurse. We'll also be looking at the elements of the community health assessment, data collection. We're just touching the surface today because our time is so limited. But I'd also like to share with you a lovely experience that I had in 2019 in terms of conducting a community assessment here in my local area. So we'll be going through that with you and talking about that community outreach event that resulted from the community assessment. And then we'll have some time for questions and answers, okay? So my first slide here is pretty much just highlighting the modern study of public health. Our founding father, if you will, Charles Edward Winslow. He's a leading figure in the United States and actually founded the Yale University of Public Health. So he holds a very prominent role in our history of public health, and he defines public health as the science and art of preventing disease, prolonging life, and promoting health through organized efforts and informed choices of societies, organizations, public and private communities, and individuals. So if you'll notice from his definition, there are many influences. There's broader societal, community level influences, and also touching on the individual level. We're going to go over some of these areas as we walk through this talk here today. Before we do that, I'll share just briefly the mission of public health. According to the Institute of Medicine, it states that the mission of public health is fulfilling society's interest in assuring conditions in which people can be healthy. So what are we talking about? We're talking about safe place to live, play, and work, and in our case as students, also to study. So having that safe place. Similarly, the World Health Organization stresses that public health aims to provide maximum benefit for the largest number of people. So we're looking at what's best for all. So public health focuses on groups of people rather than just on an individual, as you may have been studying in your nursing program so far. We look at one patient or maybe the patient and their family, but in community and public health, we're looking at a larger group. So at the core of public health lies the principle of social justice, providing people the right to be healthy and to live in conditions that will support their health. So making sure that those environments that they live, work, and play in are safe for them to do that. So the public health approach. So if we look at the broader context, public health problems are diverse and they can come in many forms. So infectious disease, chronic diseases, emergencies, injuries, environmental health problems, as well as other threats to health. But regardless of the topic, we take the same approach to public health problems, following the 4 steps you see here. First, we ask ourselves, what is the problem? In public health, we identify the problem by using a surveillance system to monitor health events and behaviors that may be happening in a certain population. After we've identified the problem, the next question is the cause of the problem. For example, are there factors within a certain community or a population that make them more susceptible to disease, such as something in the environment, or maybe even behaviors that the people are practicing? Once we've identified the risk factors related to the problem itself, we ask what intervention would work for this problem and what would address that problem. So we look at what has worked in the past, and we think, did this method work in the past? Will it work for this particular problem? And so just to kind of bring it to an actual example for you, when you think about COVID-19, and we're working on progressing towards a vaccine for COVID-19, you might want to compare that to the example of influenza vaccine. So before we had the vaccine, we had many loss of life, and we have reduced the loss of life with that vaccine. So that's looking at what's worked in the past and using that potential for this new health risk. That's your sample there. So in the last step, we ask, how can we implement that intervention? Given the resources, do we have the funding? Do we have the support? And will it affect this population in a positive way? As we go through the talk today, we're going to see examples. Well, actually, I'm going to share one particular example of the public health approach that I used. So, what are the levels of prevention? I'm so glad you asked. So when you think about the levels of prevention, primary prevention, secondary prevention, tertiary prevention, I'm not sure if our poll can launch, but I would like to invite the question to you. We're talking about assessment, education, and planning. Where do you think health education falls in the levels of prevention? Could I take a moment and invite you to type into the chat? Where does health education fall in the levels of prevention for community health and public health? Anybody willing to make a guess? We have shy typers. Okay, well, I'm happy to share with you. Pardon me. That education actually falls in the primary prevention level. And the reason that we want to start at the primary level with health education is to reduce the costs of healthcare. So the cost savings that can be noted by providing education at that primary level is exceedingly greater than how much we would spend in treating health issues at the secondary and even tertiary level. But again, let me step back just for a moment with you. What is included in primary prevention? Health education, as I've noted. An example of that would be something like a anti-smoking or anti-tobacco program for elementary age students. We might look at, of course, because we want to stop them from smoking when they're young, right? And prevent any long-term health effects from smoking or tobacco use. At the secondary prevention level, what are the activities that we see there for the public health nurse? We see screenings for health issues and the vaccines that we just mentioned in the last example. So currently what we're seeing in my area is pop-up screening centers and swab collection centers for COVID-19. And you may be experiencing the same thing in your neighborhoods, and that would be an example of the secondary level of prevention. Another example would be a flu clinic in a hospital area, and then tertiary. When you think about tertiary prevention, this is where a lot of students go initially when they think about patient care. We think about that the patient's already sick and that we need to provide them with medication, treatment, and so on. But when you're thinking in terms of community health nursing, that tertiary prevention level would be a support service center, maybe a neighborhood clinic that provides care ongoing for chronic conditions like diabetes or hypertension, and there may be some education that goes along with that, and just supporting people as they're working through their disease. And that may look like education related to diet, nutrition, making better choices for themselves as they're working through their illness, as well as the activities that could be taking place to promote health and movement. Okay, pardon me for just one moment. I am being informed. Oh, I see that someone did answer primary level. I missed that on the last slide. Sorry, guys and gals. Thank you so much, and you were correct with health education being on the primary level. And it looks like you'll have to type in the question section if you want to respond instead of in the chat. So I apologize for the miscommunication, but it looks like that's working well. Okay, wonderful. So moving right along, now that we've reviewed a few of the fundamental elements and groundwork for community health nursing and some of the definitions for you, what is the role of the community health nurse in terms of leadership, education, and planning? The leadership role, planning, evaluation, and collaboration to arrive at that desired community health outcome, that is the role of the nurse is one of taking the lead and connecting with partners. And I'll step more into this with education. You want to provide education that is going to be focused on promoting and preserving and restoring health. And that's education that's aimed at the population as a whole. And it may touch on individuals within the community, but it is overall. We're wanting to bring community health programs that can help to achieve the goals of promoting health, preserving life, and restoring function to the community members. The third role is planning. So the nurse addresses significant health issues by working with community partners. Those partnerships are critical to providing interventions at the community level that are appropriate for that community and gaining the trust. And we'll talk a bit more as we walk through here. Let me share this next item with you. So a lot of times nurses ask themselves, what do you mean community health? What is a community, right? So first, in assessing a community, you have to look at everything that's within that community. So depending on what your community is that you're focused on, right? What is the community comprised of? People. It's usually in a particular location or an environment, and there may be some social systems that are elements of that community. What is supporting the health of the community? So a community can be shared by those in a certain place, as I said, and those individuals may have certain characteristics that are similar. And you can see the slide here. I don't want to read that slide for you, but an example of these pieces would be like a geographic community. So everyone living in Chitkara, that would be a community, right? Demographics, let's say nursing students, that would also be a community. It could be all of the nursing students at each of the campuses. That may be the community that you're looking to serve their health. And then there may be functional communities. So different groups within the community itself. So maybe just a subset. So how does the nurse decide what implementation is needed for the community of interest? I'm so glad you asked. The most important piece in community health nursing is making sure that you collect appropriate data. In order to collect data, you have to do your assessment. What does assessment mean? We know what a head-to-toe assessment is in nursing, right? Starting at the top, you're going down, you're getting the patient's whole entire history, but what does that look like in terms of the community? The community assessment, that first step, the nurse needs to gather many pieces. So in order to conduct a community assessment, you're looking at an all-inclusive approach that emphasizes the community as the client, as I mentioned before, and the goal is to provide benefits to all of the people living in that area rather than just to individuals. So when you're looking, you see the interaction with the community partners as being part of that assessment. working with people and programs that are already established in the community to see where there may be some gaps in service, and looking at the evaluation steps. So what and where are the gaps, trying to support the future services that may be necessary for that community depending on what's already being offered there to support the health of the community. So we're looking for the community-specific program planning by doing the community assessment. So in terms of leadership, the nurse leader ensures program planning reflects the community's actual priorities. So program planning should step through those priorities in this sense. So when you're working within a community as a professional nurse, you don't want to just come into that community and start telling people you need this, you need that, this is a priority, that's a priority. You actually need to build those relationships and work with the people that are living within that community and find out what those priorities are for them. So you conduct your assessment, you may identify several health needs within the community, but talking to the members, and I'll talk a little bit about gatekeepers in a moment, but talking to the members within that community to find out what are those priorities, priority health issues, how do they affect the health of the community itself, and with that step, with that impact of the issue, are the community members concerned about the prevalence of that particular illness or issue? Is there a significant risk outside the health of the community? So just in the example that we're working with right now with the pandemic with COVID-19, there are some economic impacts to this significant health risk to all of our community members. So folks being out of work, the impact of having to implement additional health care that wasn't planned for ahead of time, especially with so many people being hospitalized at the critical care level. So those would be some of the economic impacts. And then third, we're looking at will the program implementation improve the health outcomes? Or is it a method in which to help the community to navigate around the adverse side effects? So I'm not sure if you're thinking in terms of COVID-19, avoiding becoming ill and or how to manage the illness if you do become ill with COVID-19, and how to help others, right? All of these elements are part of that navigating around health issues and working with the community members to make sure that everyone is informed and knows what's best for them and their community members. So the nursing professional brings the vision that drives that connectedness and the necessary pieces to develop sustainable health programs within a community by managing all of these different steps. But in my mind, some of the most important things outside of the assessment is really building those relationships, establishing the trust with the gatekeepers. They allow you, once you're inside and you build that trust, to be aware of other issues that may not surface normally. The gatekeeper, that would be a community leader who can create opportunities for the nurse to be able to connect and actually touch the community. They can make way for you to be able to provide health education and maybe secondary and tertiary levels of care within the population. So if you are able to establish those partnerships with the gatekeeper, you may be able to then step into those long-term partnerships and, like it says here, integrating yourself into the community as a trusted member, right? And the nurse, if you do become one of the community members, oftentimes you're able to see more than what would initially surface on a community assessment. And let me talk a little bit about some of the levels. Oh, pardon me, my slide jumped up for me. Once you've built those relationships, you would go to the next steps, which is gathering that community assessment data. And the data can be collected in many ways. So you may interview members of the community. You may hold public forums where you call people to come together and give their concerns and ideas about what are the health needs or the health impacts within their community that need to be addressed, like environmental risks that may be present. You could conduct some of the data collection through secondary data sources. For example, in the U.S., we have the census that's taken every 10 years. There's a plethora of excellent information gathered there. We get information about our community members' education, income levels, members of their household, employment rates. Lots of great information is available in the census. Another great source of secondary data would be from health records. Medical health records, if you're working with a clinic or even a hospital, you may be able to gather a lot of really good data that would help to guide you on what educational programming may be best suited for the community that you're working in. Another piece would be, another area where you can collect data would be through focus groups, where you're actually bringing a sampling of the community members together to talk with them about those health needs, but it can be a little tricky to get people to volunteer to join in on focus groups. And you could send out surveys to your community. Written surveys are a little bit more expensive, but with today's technology, we could use electronic surveys to gather data and find out if community members what types of education they're interested in, what kinds of methods may work, educational methods may be welcome by that community. And last, I would say that one of my favorite activities for my community health students is to participate in a windshield survey. So what is a windshield survey? It's exactly what it sounds like. So if you imagine the windshield of your car, this is what I usually do in my class, put my hands up, and you get in your car or you get on the bus and you ride around the community that you're focused on. And you take a look, who are the members of that community, who's out and active and about in the community, what types of resources do you see within the community, as I mentioned earlier, who are the partners that are already there? Are there hospitals? What are the food sources within that community? Are there churches and other organizations within that community that oftentimes do part of the community health work that is happening, at least in the US? Oh, it looks like I have one question, and let's see here. Oh, okay. Thank you. I see that. Let's see here. What is health promotion? Why is health promotion more important than Oh, thank you. So the question that's here says, why is health promotion more important than disease prevention? So it's interesting how you asked the question, but actually health promotion is a very important factor to disease prevention. So if we can provide education about promoting one's health, that serves as prevention. So let's see, in terms of obesity, if we're educating the community on healthy nutrition, healthy activity, and where would you want to start with your health education? When someone's in their 60s or when they're sick? What do you think? See if anyone answers in the chat box here. Or in questions, excuse me. 6, yes, we definitely want to start with that health promotion education when one is young and they can take it in. And I don't know what your experiences were growing up, but for myself, I had a lot of wonderful education when I was only 4, 5, and 6 years old on how to take care of my teeth, still got them, and how to make good choices on nutrition. And you know, if you look at the nutritional chart has changed a lot over the years, but if you look at the food pyramid on which section you should choose more of, you will be able to see how to manage a good diet, and even My Plate is a lovely example of how to manage nutrition, but yes, you would want to start young. And when you teach someone how to take care of themselves when they're young, in terms of activity, nutrition, and let's say, because this may be, your question may be related to maybe a risk factor for, in some families, there's a higher risk or incidence of diabetes or hypertension, and you would want to teach someone early what they can do to keep their health strong and solid for as long as possible to avoid those health risks. I'm not sure if that answers your question, but I want to be conscientious of the time as well and move our time along here. Actually, yes. Okay, here we go. Let me know if there's any other questions. I'm happy to try to assist with. Okay, so we were just getting to snap to this next slide. I think maybe it will move for me. Okay. All right, there we go. So with community health program planning, that's just a fancy word to say that what is the intervention that you're planning to integrate into the community. So is it a health education activity? Is it a community engagement event? What type of a program are you going to be implementing? Well, that begins much before the assessment itself. You start with your pre-planning, brainstorming different ideas. You need to have access to the community, right? I mentioned earlier, you just can't come into the community and say, hi, I'm Nurse Bethany and I'm ready to save the day and I've got a lot of great ideas. I see you have got all these health issues and I'm here to, to tell you what you need to do about that. You definitely want to start with gaining the trust and building those relationships with your gatekeeper. That person is the one that's going to be more influential over all of the community members and will help to bring the community members in to not only be interested in what you have to share, but also to help you to guide where you want to start your community intervention. So bringing the community's awareness to supporting and getting involved in a community health program is really important. And that pre-planning, kind of thinking about how that community works, and talking with your gatekeeper and other people of influence within the community is important. So we talked about the assessment, that you're going to go through the assessment, diagnose the community's top health issues, right? And you're going to work with those stakeholders or the gatekeepers and help them to keep you guided on the top issues. And if you have your stakeholders and your gatekeepers support and they're building that bridge to the community members, the likelihood of your program or your intervention being more successful is very, very possible. So at the planning stage, we're analyzing and establishing the priorities among all the different health problems that may be present within the community. We're looking at the possible solutions, kind of trying to think about what are the best options for this particular community, and do we have resources available? Are there resources? We can have the best of ideas and the best interventions, but if we don't have the resources or we don't have the buy-in or the interest of the community, it will be very difficult to set goals and objectives that will be attainable within your program plan. So what types of activities would you need to use to build a successful plan? You're looking at that in your planning stage. So implementation is you do the thing, execute the plan, implement whatever the intervention is, and then you often forgotten by many, not necessarily nurses, what can I say, but oftentimes community groups may implement plans to help with health issues and other concerns within the community, but they forget to go back and evaluate whether those implementations were effective. Measuring the success of a program and determining the community's satisfaction with that particular program or that intervention and outcome is really critical to, to establish that ongoing program sustainability. You want to ensure that the program's success and that that the program is successful, and as well as meeting those changing needs that may be happening within the community. So let's say, for example, we have a community that's not very active, but we implement a plan to get people out walking. I'm trying to walk 5,000 steps a day. How many steps are you doing? I have no idea, but it's hard to get out there and get the activity going. But once you get them into the mode, and maybe you have your community members moving around and staying active, what is the next step? Is the next step helping them with nutrition? Is it talking about other environmental impacts like cleaning up the community, looking at maybe clean air? Those might be some of somebody got unmuted themselves, and then I got muted. So sorry about that little interruption, folks. Okay. I can't wait to show you about this exciting activity I had last year. So just really quickly, we went through the public health steps, and public health in action is determining what is the main issue, right? What caused this issue, or what are those risk factors for the issue, and then how can you intervene and what will work for that particular issue. What can you do? What can you do about the issue that you've identified? Let's see here. I went through those. Wonderful. So I'm really hoping that you will just take a moment to walk with me through this community activity that I was able to participate in early 2019. It takes place in Long Beach, California, which is very close to where I live. So I provided you with a map of the US with California red on the map. That's the state that I live in. And if you take a look on the map itself, right in the southernmost region, I'm not sure if you're going to be able to see it very well here. Here's California. And then on the lower level of the state right there, and that's right outside of Los Angeles, California. Lots of people are familiar with LA, or it seems. But why did I select Long Beach as the community to focus on? Well, it's very close to my home. I'm actually work in that city, and Long Beach is, for your knowledge, it's the 36th most populous city in the United States, and it's actually the 7th largest city in the state of California. So since I'm employed there, I thought that it would make sense to house my community project in that region. So in 2016, the city of Long Beach conducted a community health needs assessment. And with that community health needs assessment, they were responding to national legislation, the Affordable Care Act, that was requiring all local health organizations to conduct a deep assessment of the health needs within their area. So they were looking at primary and secondary data, and they were identifying the most significant health needs and what could they do to improve the health of the community. So the four measures that they use to rank the health needs and how do you come up with the top need is looking at the severity of the health issue in that community itself. So morbidity, mortality, the economic burden of the health issue, disparities. So is there a particular group that's at higher risk? So the disenfranchised groups like racial groups, age groups, genders, and those that live in certain regions. Prevention was another measure that's used, and that's what is the potential to reduce the impact to health by implementing a intervention at that particular level. And then leveraging issues. So prevention, enforcement of policies, leveraging, looking at targeting several different health concerns at the same time to arrive at a really great outcome and improve the health of the community. So, sorry, my little guy popped into the screen really quick. So this is the level of surveillance, right? So some of these rankings, the measures looking at how difficult the issue was, which groups are being affected the most, what measures can be implemented to improve health, and then looking at a multi-focal approach to issues by leveraging time and talent. Sounds familiar, right? It sounds really similar to what the nurses' priorities are for looking at the community's issues, the significance of the risk to overall health, and if there's any economic impacts, and also improving the health outcomes for that community. So there's a lot of similarities there that are seen between the community health needs assessment and the responsibility of the nurse in prioritizing health needs within a community. So from this health needs assessment, you can see here on the screen that mental health was actually the #1 health concern in Long Beach. And then secondarily was economic security, which is number 2 and number 4 are very closely related to homelessness, and there is a high population of homeless and poverty-stricken families in Long Beach, California. And then third on the list, which shouldn't be terribly surprising, is obesity and diabetes. If you look at health needs around the world, obesity and diabetes and related health issues typically fall in the top 10 causes of death in countries around the world. So these are the top 4, and mental health made its way to the very top health issue in Long Beach. So with this discovery, I tried to formulate a plan. What can I do? What can I do about mental health? What can I do about mental health? I mean, this isn't my job. This is just something that I took on as a special project. What can I do to impact mental health in the city of Long Beach? Well, the World Health Organization defines mental health as a state of well-being in which every individual realizes their own potential. They can cope with the normal stresses of life, and they can work productively, and they're able to contribute to society, right? That they can be an active member of the community. So if mental illness is at the top of the issue list, the health issue list for Long Beach, then, how can I intervene to make a difference? So for me and some of my colleagues, I talked to a lot of people, which sounds like part of that community assessment, right? Talking to stakeholders, getting a hold of gatekeepers, looking at different organizations that are already doing good work around that community. After doing some of that that legwork, I wanted to identify what are those key action items that I can participate in that will promote a mentally healthy lifestyle. And maybe that's related to activity, maybe that's related to nutrition, maybe it's related to just getting people talking about mental health and raising the awareness. And I am was definitely interested in touching all of the community members, including children and adolescents. So, is mental health a big issue in North America? Yes, it is. So, according to the National Alliance on Mental Illness, NAMI, 1 in 25 in America are living with serious mental illness. And when you think about 1 in 25, that may not seem as impactful to some of you, that maybe you don't have a reference point, but it's 10 million people. And that's a significant number, and that is definitely a reason for nurses everywhere to want to take action to promote mental health and wellness, right? So, okay, what can we do? What can we do? So now that we have identified the issue, now we're looking at what's causing this issue to be number 1. What is causing it? I assume that it's stigma, it's lack of access to healthcare. What is it? I need to talk to more people. I need to get more information. So that's exactly what I do. What's going to work to solve this issue? After talking with many of the stakeholders and many community organizations, I was able to partner with a local church and the California Mental Health Services Authority with a small mini grant, and we launched a community outreach event that also incorporated social media. it's a lot, right? I ask you in the audience today, have you or any of your family members or friends ever been affected by a mental health disorder? You could raise your hand. Maybe that's an easier way. Maybe you don't want to identify yourself. I'm not sure, but we'll be hard pressed. Oh, I see. Yes, hang on. I'll be able to. Oh, great. So there's a poll that's popped up for you to be able to answer. How are we doing here? We'll have that open for just a small another moment. Have you or any of your family or friends been impacted by a mental health disorder? Okay, so the numbers are actually on the lower side. So we're still, let's see here. Yep. So it looks like about 30% are saying yes. So it's actually a higher percentage than what we have, right? Very high percent. Oh, we're getting more answers in, so it's popping down right into the zone. About 25%. I'm going to close the poll now. And I just want to make sure that you can still see my screen, my slide. Are you able to see it?
Yep, we can see it.
Thank you so much. Excellent. So a mental health and wellness outreach program was what I thought might be the first step to get the community aware of the issue, get people talking about it. And by working with community partners, as I mentioned previously, I was able to find an organization that would donate a site for us to provide the outreach event. And I like to call it a health fair. And that health fair was to get people talking about mental health, and with the hope that we might be able to reduce some of the stigma and encourage community members to seek out help earlier before it becomes a serious issue. So let me just share with you a couple of little things here. So in the US, May has been identified as a Mental Health Awareness Month since 1949. So for over 50 years, for longer than my lifetime, May has been Mental Health Awareness Month. And we were promoting our activity during the month of May in 2019, and we worked with the California Mental Health Services Authority, as well as NAMI with their Each Mind Matters and Strength in Community campaign. We used those two hashtags, if you will, to promote the event. And another key element was during our outreach event, and I'm going to share some photos so you're not just looking at slides with words on it here. Another element of that outreach event was educational set on from the NAMI organization. And if you're not familiar with NAMI, I guess I should mention that now, is the National Alliance on Mental Illness is the largest US-based grassroots organization that is all about promoting mental health. They are dedicated to bettering the lives of the millions of Americans that are affected by mental illness, and they have many different programs to serve on different levels. They work with all different populations. They have programs that are dedicated for families, for younger adults and college-age students as well. They have a lovely array of educational sets for the promotion of mental health. And they have an amazing program, and they work mainly with volunteers. So I invite you to take a peek at their website and see if there's something of interest for yourself. So moving on, the Cal Mesa organization offered some funding, and we were able to access that funding to support our outreach event. And so now we have our implementation. So that is what we're going to do for our implementation of the health issue of mental health. So In terms of the social media aspect, and I thought this might be of interest to you, is we utilized 3 different outlets. So we wanted to make sure that we were spreading the message about mental health and the disorders. We had created a Facebook group page, and that's still up, and I'll show you the tagline on that one. You'll be able to go there and investigate it. I know a lot of college students are on Facebook, and that social media platform incorporated not only Facebook, but we also utilized Instagram and Twitter. And our team was researching different events that were all about promoting mental health that were happening not only in our local community, but in the state of California as well as nationally across the country. And so what we were attempting to do was to get out the message 6 days a week to the community and everyone that was connected with our main Facebook page and the Instagram and Twitter, and to get them talking about and gaining access to information about local events. And that team worked really well together, and in fact it was comprised of bachelor's of science in nursing students, just like many of you, and they did an amazing job. So here's the banner from that Facebook page, and through the social media campaign, I had to put this slide in to my slide deck today to share with you. We had over 38,000 touch points of that Facebook page touching the screens of community members, and that's what everything is about, is making sure that we were pushing out awareness about mental health, not just promoting our event that we were holding last year, but also to promote the other events within the community. So yeah, over 38,000 touch points. It was pretty incredible. And our goal was quite a bit lower than that. So we're very happy to have made those touch points. Oh, forgive me, I misspoke on the outcome was 13,000, pardon me. Our goals were 38,000 did actually touch the Facebook page, but our goal was to reach community members, 4,294 community members. That was our initial goal to meet, because that's how many people had lost their life in the state of California in 2018. So we picked that number and we targeted that number of people to reach within our own population. And I was very proud of our social media team, and it was a really neat time for all of us to see how many community members we were able to impact with that portion of our outreach. So what was the event itself? The event itself, the education and the public awareness event, was focused on increasing awareness with the community events, like I mentioned earlier, making sure that we could engage somewhere around 75 to 100 community members with those pieces there. And our secondary goal was to reduce stigma associated with mental health by promoting the Each Mind Matters campaign. And I think we were pretty effective with that, and that's exciting. The third item was to provide self-screening opportunities for adolescents within the community. So we actually had some electronics, some technology available for community members to go online and do a self-screening, and that was through the Here to Help program, and that's actually a Canadian-based program for screening for mental health issues. And we had a great time with that. Many people were very interested. They were able to self-screen privately. They didn't have to share any questions, but we had lots of resources and a counselor on hand to talk to people if they felt like they needed to chat with a professional. And that's not me. I'm not a professional counselor. I am a registered nurse. So it was important to have someone on hand to be able to speak with folks. The other piece in terms of adolescence was just hopefully identifying elements of depression, and so that they could look out for one another and report and support one another if there were any elements of mental health disorders identified. Okay, so what did the event actually look like? Our day, we had a small storefront in a small section of Long Beach. You can kind of see our team here in the middle, standing in front of our community event location. And we had our members in the community sign in. We had lots of giveaways that day. The organization, as I said, the faith-based organization provided us with the building, and we had lots of volunteers to support the event. In fact, there were no paid participants. Everyone came of their own free will, and actually some of my colleagues joined me on that day that live local. It was a lot of fun, and we offered all types of activities that day. So there were areas for children to color and to get free books talking about mental health with their approval of their guardian or parent. There was education about healthy, active lifestyle for individuals that were interested in looking at how to improve their overall health. And as I said, the NAMI organization provided education, and I'll share that on the next slide. We had 52 participants at the health fair, and that was the social media campaign ran from April the 28th of 2019 all the way to June 1st, which would have just been past year, one year. And here we go. The National Alliance on Mental Illness, all of their educational offerings are provided free of charge to the community. And every presentation that they provide is delivered by someone who is either a family member or someone with living with a mental illness. So this particular event, we offered the Ending the Silence, which is an anti-suicide program, and that talk was given to 47 attendees. And so we were very happy that we had many people within the community that were interested in getting that education on suicide and how to watch for signs and to see how they can support others that may be going through a difficult time, and getting them the support services that they would need at that moment. So definitely a special thanks to our partners at NAMI, and in these photos you can see Jalissa Hibbard and her son Ethan. They provided that, they facilitated that Ending the Silence talk for us. And let me see if there's any questions or anything else on the screen here. I guess I'm going to have my partners help me with fielding some of those questions because I cannot read all of them. I only have a bit more to share with you here. I want to watch the time as well. Oh yeah, time right now. Okay, so really quickly, so in developing a community health event, you want to look at identifying the needs within the population. These are, again, kind of a repeat of some of the pieces that we've done already. Prioritize what are the learning needs and what kinds of methods might you use to meet the educational needs of the community. Are there any barriers to learning that you might need to overcome? Can everybody read? Are you able to provide information in the native tongue of your audience? And are you able to design a program that will be well received by your community? So once you implement your program, you want to have a method to evaluate it. And we did a really quick touch point on ours, which was the surveys, and that was managed by NAMI because they were in charge of the formal aspects of the education at that event. So just touching quickly on the goals and outcomes, which I mentioned some of these earlier for you. Increasing awareness, we had 52 attendees to that event. Reducing stigma, we had a lot of community members that were impacted by the actual event as well as the social media campaign. Retaining 10% of the attendees and of the adolescent attendees to do the self-screening. That was very successful, and very proud of the number of people we were able to impact in the community. And again, I go back, it was Bachelor's of Science in Nursing students that participated in a good aspect a good portion of the education that was delivered on that day. It was very, very exciting. So we've covered a lot today, right? And I'm sure that you have some questions. I'd like to take some time to respond to questions if that's at all possible. Can we do that? I may need some help with seeing which questions need to be fielded. Is there anything in particular that I can answer?
Can you see the hand raises, Bethany?
It's really small on my screen.
Okay.
I'm so sorry. It's just really, really difficult for me to see. If you can help me to manage those, that would be wonderful.
Yeah, it looks like Donna Emanuel has her hand raised. Donna, do you have a question?
Fun, or there's penne that you bought, or spaghetti. Oh.
Yes, hi, this is Donna Emanuel. Thank you so much, Bethany.
Thank you for being here. You're welcome. I think we ended up muting everybody again. Did we? Oh, no. Did you have anything?
Bethany, can everybody hear me? This is Donna Emanuel.
Yep, we can hear you.
Okay, very good. Wonderful overview, Bethany. I could not be more excited about this important topic. I think mental health issues and where we are as a academic institution in integrating mental health competence this arena.
Unfortunately, you're breaking up, Dr. Emanuel.
I was wondering if you could shed some light on the best practices of integrating mental health competencies within academia.
Best practices, you know, that's a wonderful question, and I think that it's really critical in nursing education to definitely thread in the components of mental health and the importance of getting all members talking about mental health. I find that in my own personal and my professional experience that sometimes individuals are uncomfortable talking about mental illness, and they're afraid that if they bring it up, it might cause someone to have difficult feelings. And we are professionals. We just simply need to integrate the discussion at all different levels. When you are addressing mental illness, if you look across the lifespan, it touches all areas. So I'm a mother-baby nurse by that was my first role as a registered nurse, was in mother-baby. But you could begin across the entire lifespan. But with the high incidence of suicide, depression, and anxiety around the world, it only makes perfect sense that we should be integrating this in as a high priority, as high, and if you'll notice in that community assessment, above obesity and diabetes and hypertension was mental health. But by threading those conversations in, incorporating these growing, learning nurses in how to have those discussions with patients and open the door for all of your patients to begin talking about how are they feeling, whether they're having any of those signs of depression or anxiety, to get the conversation started. And then how do you bring in your interdisciplinary team to help you to support that particular patient. I think that threading mental health concepts across the nursing curriculum from across the lifespan, from childhood to geriatric, because it touches every age span, is important to help our new nurses learn how to have those conversations, and also to identify what do mental health disorders look like across the lifespan. again, the conversations are so important. Gaining the comfort in approaching those tough topics is important, as any other assessment question that we might have with our patient population. Are there any other questions or comments? And thank you so much for that question.
Bethany, it looks like Christine McGladry has her hand raised.
Can we unmute her? And
yep, I just did, yep.
Okay, can you mute the other?
Hi, Bethany, can you hear me?
Yes, we can hear you, thank you.
Well, primarily, I just wanted to say that this was a wonderful presentation, and I'm so proud of you. You know that I'm so proud of the work that you've done in your DMP program, and that you're now sharing your expertise across a lot of different areas and a lot of different boundaries. So that's really all I wanted to say. It wasn't really a question. I'm excited that if I think back on, what I learned in public health, it was so much more about, these are the interventions and you go in and you take care of a patient, rather than really looking at communities. And I didn't really discover that until I got into my master's and my doctoral level. So I think it's really wonderful to start to put the emphasis in this area of assessment and planning and leadership at the bachelor's level, as opposed to waiting until people get to those higher levels of education. So just kudos to you. Thank you.
Oh, thank you so much for that. Yeah, I couldn't agree more. I think that obviously I believe that many of the Chitkara University nursing students, they are already integrated into the community and looking at ways to support the community's health. If they take a moment to kind of dissect out some of the activities that they're participating in right now, they may not understand that there's been some assessment and some pre-planning before those activities, but now that's been opened up. And I really invite you all to consider how can you help your community. And really, I also want to bring out no small act is too small, right? The smallest thing can make a huge difference in a community's overall health. It's interesting to see, oftentimes we trust and depend on other leaders within the community and even other professionals within the community to target health issues. But I think that oftentimes the people that live right down in the weeds in the community themselves, they can see what the bigger needs are. And so look around in your own community, see what it is that you might be able to support. And sometimes in terms of mental health, I invite my colleagues, students, sometimes just being a listening ear for someone to hear their concerns and listen to their stories, even if they're telling you a story for the third or fourth time. Sometimes some of our advanced, more seasoned community members want to share the stories of their youth, and it's really important that we give them the time and the space to share those stories so that we can carry them forward for them. Are there any other questions? I see some questions typed in the box and it's a little bit, okay, let's see. What is the difference between public health nurse and community health nurse? So a public health nurse is really spanning across the entire, it's gonna sound a little silly, but they're spanning across the whole region or many communities within. So a public health nurse might be targeted, and I can do only my examples from the US, so sorry about this, but they would be targeting on a county. So I live in Orange County, California. The public health nurse would be looking at the county as a whole and then beginning to dissect down what are the issues, the health issues within that county. A community health nurse might be working with just targeting the childbearing females in the population. So they would just be working with, for example, right now we have some wonderful programs for first-time mothers, and they're just targeting just that segment of the community. And so that would be kind of the difference. The public health is looking at the whole community, and then the different health issues within the community, and the community health nurse is targeting just that sub population within the larger community. Did I do an okay job? I hope I did. It's a very tricky and wonderful question. So someone was paying attention right there, so thank you. Wonderful question, appreciate that. Let me see if there's anything else that I might be able to add. As an Indian, I can validate that we have huge stigma about mental illness. People do not come out as openly as we do in the US about mental issues. As nurses, we all have to strongly advocate for the issue and help to remove the stigma. And I think my closing comments based on this comment here is stigma, it comes across all roles. So the stigma of mental illness is not just for people with mental health disorders, okay? Now that might sound silly to some of you that are a little bit more knowledgeable about mental health and mental illness, but the stigma of mental illness also crosses over to the family and friends of those that are working through mental illness. They may feel stigma about what that person's going through. They may feel many other negative, stigma is negative, issues surrounding mental illness. But that stigma also crosses over, and you can look at some of the research and data, and maybe I could get you some information later. It also crosses over to healthcare providers. And I think that goes back to the comment or question that Dr. Emmanuel brought forward, which is integrating the concepts of assessment and intervention for mental health across the curriculum in teaching future nurses. Because healthcare providers have stigma about working with patients that have mental illness and towards patients that have mental illness, that's a whole different set of concerns that we should be focused on as professional educators and as nurses. We need to help one another. We need to provide a judgment-free zone for our patients. They should be no more concerned about having diabetes as they do having chronic depression or anxiety. There should not be a stigma of having a mental illness any more than there's a stigma of having a physical illness. So that's just my added comment, and I close with this has been an extreme honor for me to come back to Chitkara University, so to speak, even if it is virtually, to share this small talk with you today. And I hope that it added to your professional practice. I hope that you feel that you were able to take something away from this talk, and that I was able to encourage you and inspire you to look at your own community and how you might be able to support it in a positive way. So thank you so much, and have a beautiful, beautiful Monday. And I think we'll turn this back over to Dr. Carr.
Yes, ma'am. Thank you so much. I want to thank Professor Bethany and her team for communicating this important information. Also, I want to thank all of you being here. Again, thank you so much, ma'am.
My pleasure. My pleasure. I'm the one that's...
So we will meet tomorrow, ma'am.
Thank you so much. Have a lovely day, and see you tomorrow morning, everyone.
Thank you, ma'am. Thank you so much. Bye-bye.
Bye-bye.